Come in.
Hi, Mr. Foster.
How's it going?
I'm good. How are you doing today?
Good.
Good. My name is Tori, and I'm with the respiratory department. And I'm here today to help you with some breathing treatments. Will that be okay?
Yes, ma'am.
Okay. Your doctor's ordered 3 different medications for you, and those medications were ordered so that you're going to be able to breathe better, okay?
Okay.
All right. So before we get started here, I just need to take a quick listen to your breath sounds and get your vitals, and then we'll go ahead and get started, okay?
Okay.
All right, so I'm just going to have you sit up nice and tall for me and take some nice deep breaths, okay? And I'm just going to take a listen, see what you've got going on, okay? I'm just going to go ahead and get your vitals here, get your pulse. Alright, perfect. Alrighty, so Mr. Foster, it looks like the medications that your doctor's prescribed for you today are Zonapex, Tudorza Pressair, and Flovent, HFA.
Okay.
So we're going to take the Zonapex first, which is a short-acting bronchodilator. It's
Okay.
going to open up those airways for you, okay? So this medication is going to be taken every 4 hours. It's short-acting, and this is going to be taken with a nebulizer.
Okay.
So have you ever used a nebulizer before?
No.
Okay. I'll go ahead and kind of explain to you how they work, and we'll go ahead and do that treatment, okay?
All right. Sounds good.
Okay. So the first thing that I need you to do is you'll go ahead and you'll wrap your mouth around this mouthpiece here, and you're just going to breathe normally,
Okay.
and then every few breaths, you'll take a nice deep breath, okay? And then this needs to always be plugged into the air compressor, and it needs to be plugged into the electricity, all
Okay.
right? So when this is working, you're going to see mist coming out of both ends. That's how you know it's working. And when it's done, it'll sputter,
Okay.
okay? So go ahead and wrap your lips around that tightly and just breathe normally. Okay, good. Every couple breaths, just take that nice deep breath in, okay? Very good. All right. Okay, perfect. That usually takes about 5 to 7 minutes is normal. You might see a little extra residual fluid down here. And if you just tap it while you're continuing to take a breathing treatment, you'll get that used up, okay?
All right.
I'm going to have you take a deep breath in and cough for me. Do you have any questions about how to use the Zonapex?
No.
Okay. All right, so the next medication we're going to take is the Tudorza Pressair. This is a dry powder inhaler. You're going to take it 2 times daily, so you'll take it every 12 hours.
Okay.
This is also a bronchodilator, but it lasts longer than the Zonapex, okay?
Okay.
So to use a dry powder inhaler, go ahead and flip the cover, reveals the mouthpiece. You'll take a deep breath out. You want to get all that air out, and you want to be really careful not to breathe into the mouthpiece, or you'll clump up the powder, okay? Then you'll go ahead and wrap your lips around this and breathe in deeply, hold for 10 seconds, and then you're going to exhale to the side, being careful not to breathe into this, okay? And I also want to show you this right here. This is called a dose counter,
Okay.
and this lets you know how many doses you have left. Remember, we're going to do 2 daily.
Okay.
So this is going to let you know how many doses you have left, and that way you know when it's time to call the pharmacy and get it reordered.
All right.
Okay, so go ahead and do that for me. Breathe out deeply. All right, go ahead and wrap your lips around. Breathe in, and hold that for me. And go ahead and breathe out. All right, I'm going to have you go ahead and cough for me. All right, perfect. Okay, did you have any questions about how to use that, Mr. Foster?
Nope.
Okay. The last medication your doctor has prescribed for you is a meter dose inhaler. This is called Flovent. This is a corticosteroid, and this is used to reduce the inflammation in the airways.
Okay.
Okay. So for a meter dose inhaler, first thing you need to do is make sure you shake it up really well. Okay. And then if it's been a while since you've taken it, you need to just dispense 1 into the air, 1 dose. That way you know you're getting the full dose.
Okay.
Okay. You wrap your lips tightly around the mouthpiece here, and as you breathe in, you're just going to push on this canister right here. Breathe in, and you'll get that dose. Go ahead and hold your breath for 10 seconds, just like we did with the dry powder inhaler.
Okay.
And then you'll go ahead and breathe out.
All right.
You don't have to worry with this about breathing back into it. Okay?
Okay.
That's just for the dry powder. So I'll let you go ahead and take that now. And that's shaking up really well. There you go. All right, perfect. And go ahead and exhale. Alrighty. Can you go ahead and take a deep breath in and cough for me? Okay. So with the corticosteroid, these are medications that you really need to rinse your mouth. It's really important that you do. Go ahead and rinse your mouth and spit that out because it can cause thrush, and you don't want to have that. So I'm going to have you go ahead and do that now.
Okay.
Go ahead and rinse around, swish around, and then spit that out for me. Okay, great. Okay, Mr. Foster, I would like you to just sit up nice and tall for me one more time. I want to take another listen to your lungs and get your vitals and see if this medication is doing its job, okay?
Okay.
All right, so go ahead and take some nice deep breaths for me. Okay, we'll go ahead and get those vitals here.
Okay.
One last time. All right, very good. So, Mr. Foster, with these medications, there's always side effects with any medication you take. So, if you might experience headache, you might experience nausea, dizziness, you might experience dry mouth. Some of the more severe things you might experience would be like eye pain or the racing of your heart. If you experience any of these more severe issues when you're taking this medication, please let your primary care physician know right away.
Okay.
Okay. Do you have any questions for me about any of these medications or how to use them?
Nope.
Okay. If you decide that you have a question or you think of something later, please feel free to call and let us know so we can steer you in the right direction, okay?
All right. Sounds good.
All right. Here's this call light for you.
All right. Thank you.
All right. And I'll see you in about 4 hours for the Zonapex, okay?
All right. Sounds
All
good.
right. Thank you.
Yep.